Hey feds, here's a common practice that happens. I'll say practice. I don't know if you could call this a practice or not, but let's take a look. This person said, I took the federal job for health insurance after retirement. That's not uncommon. There are plenty of people who go to work for the federal government and work for 5 years. If you're in FEHB for a full 5 years, you can retire and you're eligible to, with some other things, you're eligible to keep healthcare in retirement as long as you go out on a full retirement, and it has to be after age 62. So if both of those are, you're 62 years old at least, and you've worked for the government for at least 5 years, then yes, you can keep your healthcare into retirement. And that's not uncommon. People will just either go back to work or go to work for the federal government just to get the healthcare for the rest of their life. Yeah. Why not? If you can do that, that's a VHB program for the rest of your life is pretty incredible. Something to think about. There are so many little tips and tricks like this that you can use for retirement. Most people don't really think about it or don't even know the tips and tricks. And we cover a lot of those in the workshops. So make sure you join us for one.